Thais Love here. Um, Welcome, welcome, welcome to my Saturday Sanity uh, live performance, live video. And I missed you guys. I was um, out celebrating and working actually last week. And so I was not um, able to do my normal videos. And but I'm so glad to be here. We have been quite busy here at Dunamis Sound Mind Services. We've been quite busy just getting things set up for the summer. Um, got a couple of different programs that are going to be coming forth. And so I'm really, really excited, been working really, really hard just to try to get new and interesting material for you. And today, we are going to begin celebrating Minority Mental Health Month. Okay, July is Minority Mental Health Month, and so all through this month, we are going to be talking about minority mental health, what it is, why is there a need, such a great need to um, bring attention to what's going on with regards to the mental health of our various uh, minority populations. Okay, and so today we're starting, um, and I wanted to just share some things with you, some stats that I feel that you need to know, that everyone needs to know, so that they can understand the emphasis in terms of um, really everyone pitching in to help with regards to the mental health of minority populations. Okay, and so I just want to get right into it. Well, um, Minority Mental Health Month was started by a young lady named Phoebe Campbell Moore. BB Campbell Moore. Um, Back in 2008, she decided to declare um, the month of July to be Minority Mental Health Month, um, Health Awareness Month. She is an author, a world-renowned author, and um, she had made quite a few novels um, on that uh, depict um, characters who had issues with mental health, and these characters uh, were from the uh, minority population, and her books very often spoke to uh, different issues and topics with regards to minority mental health. She's an advocate, and she also brought attention with her writings and with her work and speaking engagements, brought attention to the huge disparities between mental health care, the mental health care of the minority population, as well as um, uh, the larger population here in the United States. And so we just would like to um, thank and congratulate her for her work that she's done and still continues to do, and also honor her as she uh, brings awareness still to this day to the minority mental health awareness. And so this video is done in tribute to Miss B.B. Campbell Moore and in honor of Minority Mental Health Month 2021. Okay, so um, I just when I was preparing for this, um, I just came across some stats that I just found astounding, to say the least. And I want to share some of those stats with you. I think, starting off that way, it would also help. I'm sorry, excuse the ambulance and the noise in the background. And so, yeah, I want to share these stats with you because I think that these stats speak volumes. Okay. And so, what is minority mental health? Minority mental health is um, mental health uh, issues that are um, particularly experienced by um, uh, various minority and sector populations here in the United States. Okay, and so for example, um, uh, the on average there is approximately um, 60 million people living with mental health issues, mental health disorders, and illnesses on the regular every year. Okay, 60 million people on average. Okay, and that comes out to be roughly 1 in every 5 persons um, are living with, experiencing mental illness. Okay, and so that's a large number when you think about that, and how prevalent um, it is for people to live with mental health uh, disorders, illnesses, um, and they're living with it on the regular. But for uh, members of the various minority populations, um, living with mental illness is further compounded by certain societal factors, economic factors, um, and as well as racial factors. And so I want to just share with you some of these statistics that really point to those disparities that are caused by these various societal factors um, with regards to access to mental health care and the and treatment of mental health uh, amongst the minority populations. Okay. Now, when I'm speaking about minority populations, I will explain or spell out which populations that I'm talking about. Okay. So, for example, um, there is I have a couple of statistics. These statistics are statistics that was brought to us by the Center for Disease Control, uh, particularly um, after the onset of the pandemic. Okay, so that's how recent these statistics are. And studies show that um, African American, or those who identify themselves as Black, along with um, Hispanic Americans, um, and uh, also the Asian Pacific Island Americans. Um, these all are more likely to have experienced or report experiencing um, uh, symptoms of mental illness. And but although that they report experiencing these things, and they even get diagnosed, they are more than likely not going to receive treatment right away for those mental illnesses and disorders that they are experiencing. And the statistics show that, um, for example, uh, African Americans and African Americans, or those who identify themselves as Black, are um, 50% less likely to receive treatment for a diagnosed mental illness. And um, and as well as um, Asian Asian and Asian Pacific uh, Island Americans are that they are even less likely than the African Americans to receive treatment for their mental illness. Um, they are more like 70% less likely to receive treatment um, for their mental illnesses. Okay. Um, Studies show that um, also 14% of Native Americans and Alaskan Americans have not only been diagnosed with uh, mental illness, but also substance misuse at the same time. Okay. Um, and then another statistic shows, and these are statistics, like I said, since the onset of the pandemic. Um, the another statistic shows that the LGBT community, lesbian, um, gay, bisexual, and transgender community, are um, they are 4 times as likely to um, have thoughts of or attempt suicide than any other sector of the population in this country. They are 4 times more likely to attempt or have thoughts of suicide. Um, and then I have here another statistic that points to um, more than 16% of those who identify themselves as Black American or Black with with a mental health condition um, are 2 times likely, uh, 2 times less likely to to gain access to treatment for a diagnosed mental health condition, meaning that 14%, excuse me, 16% of those who have that are African American or identify themselves as Black, um, once they have been diagnosed with a mental health condition, they are uh, twice as likely not to receive or gain access to treatment for that diagnosed mental health condition. 16%. Um, and then um, I have one other stat right here. Um, and Asian Island Pacific um, Americans are 1/3 times uh, 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 go to receive treatment or attempt to receive treatment only um, 1/3 of the time or 1/3 of the frequency as uh, white Americans go. White Americans go, um, they they go on the regular to get treatment for their mental health condition. Asian, um, Island Pacific Americans don't go as often as white Americans go. They go 1/3 as many times as uh, white Americans go. And African Americans go, um, they go at a rate of, um, they go twice, they go half the time, that half as many times as white Americans go. So, for example, if um, white Americans go to receive treatment on the regular and they go 100 times in a month, let's say. Um, an African American would go half that many times. So African American will go 50 times in the month and in that same month, and Asian Island Pacific will go 1/3 as many times as white Americans go. So they would go roughly 30 times in that month to go get treatment or attempt to get treatment for their mental health condition. Okay. Um, now you might say, okay, what? Yeah, those are large disparities, and why is that? Why is it that if the um, mental health care is there, um, why is it more so available for certain sectors of the population and not as available to other sectors? Yeah, there is a lot of reasons for that. And one of the reasons for that is that um, particularly since the onset of the pandemic, the disparities and the reasons for the disparities have increased and gotten, even more severe. So studies show that a survey showed that once different sectors of the population um, were interviewed and asked and surveyed, they stated certain things that they experienced that makes it more difficult for them to gain access to and receive treatment. Okay. And some of those, I'd like to call them hindrances to mental health care. Okay. And I have a list of those hindrances. Um, just see if I can find them here. All right. Okay. All right. And okay. And okay. Um, some of the hindrances that were stated um, and that were observed are as follows. Okay. Um, many um, many African American uh, and Hispanic American uh, sectors have stated that um, due to that they have experienced stress stemming from uh, having to worry about the stigma placed on them um, for having mental health condition in the first place. Uh, they worry about discrimination, um, eh, both um, social and structural discrimination with regards to gaining access to mental health care, as well as with regards to getting actual treatment, the type of treatment that they get um, with regards to mental health care. Okay. And then Asian Asian Pacific Americans have stated that they um, struggle with cultural differences and um, language barriers that further increase um, hindrances to them having access to mental health care. And the language barriers is one thing, but they also stated that competency levels of the mental health care professionals with regards to not only communicating with them, but uh, also understanding um, Asian Pacific Island cultures. Um, there is a huge disparity there. And so, with regards to treating um, that sector of the population, there's a lot of difficulty there, both in uh, communication as well as um, with regards to language barrier, as well as understanding what, from a cultural context, what exactly is the the mental health um, patient experiencing, what are the best modes of treatment for that person. You have to understand culturally um, what what it is that they need, and many of the mental health professionals are not versed in the Asian island Pacific uh, cultures, traditions, customs, and so their treatment, whatever treatment that uh, the professionals will um, provide for the Asian Island Pacific population is at at best inadequate, simply because of the um, cultural barriers, language barriers, um, and so this presents a huge hindrance in terms of that sector receiving um, care, mental health care, as well as it uh, presents a huge um, hindrance and denies them access, free access to mental health care. So um, those are some disparities and the hindrances that uh, cause those disparities. And so uh, uh, many of the uh, various minority populations don't have they don't readily have access to mental health care, and even those that have some access to mental health care, other things get in the way, so that they don't follow up and continue to go to all of their mental health care treatment appointments like they should. Okay. Um, and so, what are some of those things um, that prevent uh, people from going um, and staying on top of their mental health care? Um, and some of those things are things that, you know, are kind of outside of and in addition to uh, the struggles that they have to deal with regards to maintaining mental health or getting treatment for mental health. Um, there are other factors that um, they have to deal with that further compounds and complicates their their experience in terms of mental health treatment. Okay, so and those things are, um, and this is specifically since the onset of the pandemic. I mean, these issues were hindrances prior to the pandemic, but since the pandemic, it's even got even more exacerbated. And so, people are just like, you know, they're just throwing their hands up there. You know, their um, motivation and desire to seek out mental health care and mental health treatment is lessening day by day because of um, these other complications that, and they're just simple life complications that the minority populations experience in addition to their struggles with their mental health. Whereas um, white Americans, they don't have, or they may have less of these other um, complications. And so they can more readily go get treatment, and um, treatment is more readily available to them. Okay. And so I wanted to talk about those, what those things were. They were socioeconomic um, hindrances, um, simple things like being discriminated against or stigmatized, um, and your access to mental health care be different or um, subpar, or um, your access to mental health care simply be denied because of some of these things, like um, and this is since the onset of the pandemic, and so many minority populations are denied, or their mental health treatment is um, not the same as, or they're discriminated against due to things like uh, not having um, adequate access to proper housing. Um, so homelessness is a factor that impacts on a person's access to mental health care and treatment. Um, simply, uh, simply put, being um, denied or having to experience different treatment with regards to your mental health because you are, are unable to have full access to food and proper diet uh, due to economic constraints. Another constraint was um, you're being denied access to um, treatment, or your treatment, mental health treatment, is different or less than um, uh, quality standard, simply because of a language barrier um, between the mental health professional and the mental health, the person experiencing the mental health condition. Um, and so many people, they will show up at a mental health care facility looking for um, adequate care and run into difficulties and discrimination based on the way that they are treated, and with regards to their mental illness, because they may not have they might live in a shelter, or um, they don't have um, full access to food on the regular, so um, they might be food challenged, and so they don't have that, and so they can't. They're treated differently simply because of their socioeconomic status, um, or a language barrier, or um, flat out discrimination, um, being told that for fear of being blamed for spreading the virus, as many Asian island Pacific Americans have expressed, uh, which hinders them from going and receiving proper mental health treatment. Okay, and so these and many other things um, are reasons and factors that add to the disparities between minority populations and um, our white Americans in this country. Okay. Now, the minority populations, various minority populations are um, at risk um, uh, with regards to treatment of their mental health or even being diagnosed um, for various reasons, some of which I have spoken of. But I was I looked at some of the top uh, mental health conditions that um, particularly um, uh, are faced by minority populations, various minority populations, posing those populations to be at risk, high risk, for certain mental um, mental health conditions. Okay, and I want to share some of those with you. Um, okay, um, let's see. Those that are at the highest risk for um, experiencing uh, mental illness um, or poor mental health conditions, those at the highest risk, um, the, and I quote, and I got this information again from the CDC, Center for Disease Control, and also the um, the National Mental Health and the National Mental Health and Hygiene Department as well. Okay, and so these populations are at most risk for um, experiencing or struggling with mental health uh, conditions, various mental health conditions. Okay. Number one. Uh, okay, let me just make sure. Okay, yeah. Number one. Uh, African American, or those that identify as Black, and Asian, Asian Island Pacific um, groups. Um, they are at most risk for mental illness across the board. Um, and then within those groups, those who are um, refugees in this country, or those who seek asylum, um, are also are also at highest risk um, in this country to experience or struggle with uh, mental mental illness. Okay, all right, and then the next group of people who are at second highest risk of experiencing or struggling with mental health, their mental health is at risk, are uh, here um, people with learning disabilities, um, people with um, physical health conditions, the LGBT population, and caregivers. Um, these people are um, um, are uh, two times, or they're the second a group of minority populations that or sectors that are at risk for for experiencing or struggling with mental health conditions. Okay, so that's the second group. And then the third group that um, will more than likely uh, experience or struggle with mental health, various mental health conditions or mental health illness are those who are um, survivors of domestic violence, uh, those who are homeless, and those who are, okay, let me just see what I wrote here. Oh, yeah, those who are homeless and um, those, well, those who are homeless and in shelters, um, they're really really close because there are, if you're in a shelter, that's because you don't have a home, and then those who are homeless don't have a home. They are um, living on the street, or just don't have a set place, not even a shelter to stay. And so though that's that group of people, domestic uh, violence survivors, homeless, um, um, the homeless population, both those who are in shelters and those who are not. That is the third group of people who are um, at third highest risk of struggling with or experiencing mental illness. And so those are the three groups. And so when you look at the three groups um, of the three, yeah, the three different groups of um, uh, minority populations, um, you can see how mental illness can happen to anyone at any time. And, it's very difficult to try to prevent, especially given, you know, uh, pandemic conditions and things of that nature. Okay. So, also, I wanted to talk about, I have so many stats here, and like I'm still um, processing some of them because, when I see my clients very often fall into these different categories and are members of these various sectors of the population in this country. And I I see it. I see it. And so and the treatment is vastly different, vastly different. And um, you know, I it's my intention to bring uh, awareness to these occurrences and what is happening uh, to our uh, minority populations uh, with regards to mental illness and mental health. So I just, you know, I just hope that these statistics um, just kind of, sound an alarm in your minds so that um, you can see that the need is great, that something needs to be done, a whole lot of something that needs to be done. And if we don't do anything at all, it's going to continue to get worse and worse. And so um, I have some more statistics here. I have, these are different sectors of minority populations that stated since the pandemic that they have been experiencing these kinds of mental health conditions. Okay. Um, for example, um, with the mental health condition of depression, and this is since the onset of the pandemic. With the with depression, 59% of Hispanic Americans have expressed that they have experienced or are experiencing depression since the pandemic, uh, as opposed to um, as opposed to 40% of white Americans have expressed that they um, are experiencing depression. Okay, um, and then we have um, oh um, we have then of those um, who have been those are statistics for those who have stated they experienced depression and have been diagnosed with depression. I'm sorry. That's 59% of those who have been diagnosed with depression um, since the onset of the pandemic. 59% of those uh, who have been diagnosed as um, de- depressed are are of the Hispanic population. So of everybody that was um, uh, diagnosed with depression, 59% were of Hispanic American um, uh, from the Hispanic American population. Um, and as opposed to 40% of white Americans um, who experienced or were diagnosed, I should say, as being depressed. Um, and then let me see what else I have here. Um, yeah. So so there's a disparity even there, and that's simply with the diagnosis of of various mental illnesses. There's disparity even in the diagnosis, uh, in addition to the actual treatment disparities. Okay, and so now the top the as I'm speaking about mental illness, especially amongst various minority populations, um, there are uh, some top mental health, mental illness conditions that keep popping up. You know, it's just so prevalent amongst our minority population, and so I want to share that with you. And then also, um, um, I want to let you know that um, 50% of all mental illnesses um, start at age 14. Age 14. By the time a child is 14 years old, um, that child starts to exhibit symptoms of mental illness. Um, and they are um, 50% of mental illnesses, new mental illness cases are diagnosed um, starting at age 14. And then 75% of all mental illnesses um, are diagnosed fully by age 24. So between the ages of 14 and 24, um, most people who have mental illness, um, the onset of it, or um, when they first get diagnosed, it happens between the ages of 14 and 24 years old. That particular statistic really, when I think about it, it uh, it uh, it really impact on me, because you're talking about our young people uh, eh, being diagnosed and struggling with mental illness uh, as young as 14 years old. Okay, and then so they're struggling with mental illness at 14 years old, and by the time they get to be a young adult, they would have had to um, adjust to living with mental illness for at least 10 years. Um, and that particular statistic, it really, you know, speaks loudly to me, because that means that in terms of treatment, we have to look at um, making treatment more even more accessible. It's already difficult for adults to gain access to mental health treatment, um, for reasons that I had stated earlier. But it's even more of a struggle for a child to gain proper treatment and access to treatment. So studies show that um, if mental illness runs in your family, if you have a uh, blood relative like a parent or a sibling that has struggled with mental illness, chances are um, you or another immediate family member will also um, have mental illness. And so if someone as young as 14 years old is diagnosed with a mental illness, chances are uh, a close blood relative, possibly in that child's household, also is struggling with mental illness. And if that person didn't or is unable to get proper treatment and is doesn't have uh, doesn't have full access to treatment as an adult, what happens to that child that got diagnosed? And so we have to really look at different ways that we can make mental health care more available um, to the various and all of our minority uh, mental health populations. And so those are some of the stats that I wanted to share with you today um, in honor of July being Minority Mental Health Awareness Month. Like I stated before, every Saturday in this month, I'm going to be talking about minority mental health awareness, okay? Because I really want to bring as much awareness as I can to the various uh, issues and factors that our um, that our minority populations um, have to deal with, alongside and in addition to dealing with mental health disorders, illnesses, and conditions. Okay, and so that's all I have for you today. Um, I'll be back here again next week, Saturday, and we'll be talking a little bit more in depth about minority mental health. Um, we'll be looking at some of the conditions that particularly um, uh, uh, particularly affect or impact various minority populations. Okay, and so if you have any questions or comments, feel free to put those in the chat. Um, and also, don't forget to like and share the videos with all of those that really could use this information. And also, you'll be doing your part in terms of spreading awareness with regards to the minority mental health um, uh, condition in this country, the state of minority mental health in this country. So I would just love, love, love to hear from you. Again, my name is Tahis Love, and I am a certified holistic uh, mental health coach practitioner. Um, and if you or someone you know is experiencing uh, symptoms of of uh, poor mental health, um, or you suspect you or someone that you know is experiencing symptoms of mental illness, please, please, please talk to someone and get help. Uh, because living with poor mental health or a mental illness or even uh, uh, adverse mental condition, it really impacts and uh, decreases your quality of life. And we do have uh, various treatments for various mental health conditions that will improve the quality of your life. Now, being a person or a member of the minority population in this country, um, it presents um, an issue with regards to access to the uh, mental health care and um, availability of mental health care. But uh, we have to just keep doing our best to bring awareness and um, draw attention to, uh, advocate for, and just bombard the powers that be, and really tackle those issues that cause the um, disparities with regards to access and quality of treatment, uh, uh, mental health treatment for minority populations. And we can do it. We can do it. Um, it's not out of reach. It's just that we have to, more of us have to become aware of these various disparities, and we have to work hard to create legislation to put in place various institutions and systems so that everyone um, can have full access to proper and adequate mental health care. And so, do share the information. That's why it was uh, created. So, do share this video, um, ask questions, uh, do your research. If you suspect that someone or even you may be experiencing mental illness. Like I said, during this pandemic, things kind of uh, got even more exacerbated, and it really more complicated. And so, and the impact of the pandemic alone uh, is enough to really cause uh, most people to have some struggle with regards to their mental health. And so, but there are things that you can do to combat the impact of the pandemic. Um, First of all, institute a proper and regular self care plan. Um, I can't emphasize that enough. If you are not sure, you need help instituting that self care routine, feel free to call me, reach out to me at 718-576-8110, or you can email me at dunamissoundmind@gmail.com. Um, reach out to me because I can help you with that. That can help um, prepare you or brace you or offset um, some of the impact of the pandemic on your mental health. So get a self-care plan, routine, and implement that in your life immediately. Another thing is talk to someone. Talk to someone, get help. Talk to someone. Have those difficult conversations. Um, Reach out and check in on your friends, your family, your co-workers. Um, because someone that you know may be suffering in silence and just need that encouragement from you or me to go and get help. So do the wellness calls, just call up and reach out, how are you doing? How are you feeling today? Um, because just that gesture, could be the difference between someone um, living or dying these days. Um, People are really going through it. And so um, we need to help each other. Um, and we can do it. We can do it if we all just do our part. So get yourself a self care plan instituted. Make your wellness calls. Just call and check up on, your family and your friends and your coworkers. Just see how they're feeling, how they're doing. Um, if you are someone is having an issue, you know, don't be afraid to have that conversation. Look, this is how I'm really feeling. Be honest, and talk about it, talk it out. It's very difficult to help someone if they are silent. So, and have those conversations. Make that, bring it to that person's attention. Look, I noticed that your mood swings are like crazy right now. Are you okay? You've been sleeping an awful lot. Are you okay? Um, I missed you at our regular gathering. Um, are you okay? Just simple questions like that. Just to do that wellness check. And it's okay not to feel okay. All right, it's okay not to feel okay. Just let someone know that you're not feeling okay, so that you can get help. All right, and so and then continue to advocate, um, you know, uh, seek out proper um, mental health care for yourself, for your family, for your friends. Continue to do that, so that we all can get have access, full access to uh, what's available out there in terms of mental health treatment. Okay. Um, and so that's all that I have for you tonight. And so I will see some of you all next week, um, on next week, Saturday, for more of our Saturday Sanity series. Um, and like I said, we're going to be talking about minority mental health every Saturday this month. And then some of you all, I will see you tomorrow. Tomorrow, I'm here at 1 o'clock, where I speak on our Mind for Christ series, where I talk about mental health as um, as it is um, spoken about from the perspective of the Bible. So I'll be here tomorrow, 1 p.m. and I'll be talking tomorrow um, about uh, health and healing. What does the Bible say about that? So stay tuned tomorrow. Thank you so much for allowing me to share. I um, hope that you were informed or at least aware. Don't forget to let me know, put it in the comments, um, place your questions, your comments right there in the chat. I will be checking the chat and responding immediately after I end this live. And so I'm going to do that right about now. And so thank you so much. All right. Take care. Um, and, feel free to reach out to me. I am here for you. And because at Dunamis Sound Mind Services, we help you be a better you. That's all I have for us tonight. So good night. Take care. Bye bye now.